Kenny Chesney coming back to FedEx Field, bringing along Eric Church, Eli Young Band, and Casey Musgraves May 25th. Keep listening for details on how to score yourself some tickets from 100.1 The Wolf. Here's Kenny with El Cerrito Place. The biggest hits, the biggest stars, 100.1 The Wolf, a 40-minute cruise through the country underway. I'm Monica Black, and this is Young Hunter Hayes. Somebody's Heartbreak on 100.1 The Wolf. The biggest hits, the biggest stars, 100.1 The Wolf. Toby, As Good As I Once Was on The Wolf. The biggest hits, the biggest stars, 100.1 The Wolf, 40 minutes of non-stop country with Casey Musgraves. It's Merry-Go-Round, 100.1 The Wolf. Tri-State's Fast Country, 100.1 The Wolf. Casey Musgraves in Merry-Go-Round. Casey on the road with Eli Young Band, Eric Church, and Kenny Chesney coming to FedEx Field May 25th. Keep listening for details on how to score those free tickets. In the meantime, we got WVU men's basketball action coming up for you tomorrow afternoon from Purdue. It's a non-conference game, of course. Tip-off at 2 o'clock tomorrow afternoon, and your Coliseum countdown starting at noon right here on 100.1 The Wolf. That's not right.
About your health, about your mouth, all kind of good stuff. Well, good morning, Dr. Bailey, and how are you this morning?
I'm great, Mike. How are you doing?
You know what? It's a great Friday. We made it through the week. It was one of those, I have to admit, people always say this, but it was really true for me this week. Wow, what a busy week. But there's almost like this feeling of accomplishment, like I'm planting the flag on the top of the mound. You know, we made it to Friday, and all things have gotten done. So what about your week?
Oh, it's been a great week. Worked really hard, and my children are driving around listening to the radio show. Bailey got his driver's license.
Hey!
So, very cool. So the topic that we're talking about today is grinding your teeth.
Is that what you're doing now?
In the fact I'm turning a 16-year-old loose, maybe grinding my teeth.
Do you have a little LED light flashing on his car to let him know, new driver, new driver? No. Listen, I'm sure he's a great driver, and he's doing it right now. So don't listen too hard. Pay attention to the road now. Don't listen too hard. So anyway, but, grinding your teeth. Boy, talk about, I think, something that affects many more people than we'd like to admit. You always have those research numbers. What are we talking about here when you're talking about how many people are affected by this?
Well, stats show that everybody grinds their teeth at one time or another in their life.
Well, there's no doubt about that. I have caught myself actually on the air, with a certain subject matter, and there you are, and you have to relax your jaw. You've got to kind of catch yourself. So
And, when I was doing my research on this, one of the things I stumbled across I thought was really cool, in the Bible, it's called gnashing of your teeth.
Oh, that's right. Yeah.
And
okay.
it's mentioned 7 times in the New Testament, in 5 of the parables and 2 in the Testaments.
I never realized that. But of course, everyone knows that phrase that has read the Bible at all. You're right.
Gnashing of teeth. It's actually representing torture.
Mm-hmm. Wow. Wow. So this is kind of important. Well, let's get into it a little bit. And, I guess some of the reasons why do people grind their teeth?
Well, there's lots of reasons people grind the teeth. And the first one I want to talk about is it's a neurological condition. The brain drives the body, and there's a subconscious response and a conscious response. Now, let me give you a good example of a subconscious response. We breathe in, we breathe out. We breathe in, we breathe out. But we don't stop every second of the day and say, time to breathe in, time to breathe out. So there's a subconscious thing going on, and there's a conscious thing. So this bruxism falls in a neurological condition where you do it, and the brain's telling it to happen, and you have no control.
I think that's incredible. It's just kind of an auto. In other words, like almost an auto response to something going on. And so what does cause that? If it's just coming from your brain, is it defending against something? Is it trying to tell you something? The body is usually trying to tell you something when these things occur.
Well, if it's not a neurological condition, it can be other conditions, sort of like if your teeth don't align properly. I like to bring up bruxism. You say, why you talk about bruxism? I'm a dentist because I look at teeth all day. But if the teeth do not align properly, I always tell my patients, if you can't find it, you'll grind it. So you're trying to make them align properly. And, lots of people know that when a horse, their teeth doesn't come together, they do what's called floating, where they kind of grind it and make them come together. So it actually occurs in animals as well. Another cause of it is, we were just talking, stress. That's why in all humans who've had this, stress is a huge component.
Well, I'm raising my hand in the studio here. Yeah, that's me. By the way, I'm here with Dr. Jeannie K. Maley, and we're talking about grinding your teeth. Bruxism, the gnashing of teeth. I like that. I sound very scriptural now. 304-345-5858, 304-345-5858.
And now there's a couple other causes I just wanted to go over with you there. Just so you know, Mike, diet is a big one, which we're going to talk about later, how to adjust your diet. But people who do a lot of caffeine and, medications, if you're doing a lot of amphetamine type and meth or any drugs.
Sure.
So, there's a lot of diet, medication involvements. But one of my things that I truly, truly have to look at is when people write down acid reflux. You have a digestive problem, and I look at those teeth and see they've ground. I have to see, does that patient have sleep apnea? That is such a red flag flying.
So one of the major things that you look at, even because you deal so much with sleep apnea, the teeth. And if there's acid reflux and they're grinding, it's almost like a flashlight saying, hey, look at me. There's probably some issues here asleep.
It's the red flag. And it's important for me to look at that. I feel bad that people have ground their teeth, but more importantly, I have to diagnose, is this a life-threatening condition?
Sure. When you say that, and it was something when I first started doing the programs with you, to realize that all these things that you talk about, even though some of them are maybe more common than others, certain things that are going to affect most, not all. But when you talk about all this coming back to sleep apnea and some of those other things, it really is a life-threatening situation. And I can remember even some of the callers that call in, and I think they're a little astounded when they learn, hey, what's happening to me if I don't take care of this or go see you or someone? This is a life-threatening situation, and I don't think all the people really believe that just yet. But the stories I've heard now, you've made me a believer.
And the reason that the life-threatening thing goes on is the body wants to live. So what happens when you go to sleep at night and you brux? Now, there's a difference between clenching and bruxing. Bruxing is where the jaw is moving sideways. You're grinding, grinding, grinding. And then if you're clenching, it's just a sustained hold down of the muscles. But people at night want to live when they have sleep apnea, so they'll grind their teeth trying to open up that airway.
You know, I was told one time by a wise lady, she was a kind of a secretary-treasurer for a very small ministry, but she was in her 80s when she was doing that, and she lived up until almost 100 years old, full of wisdom, traveled all over the country and did different things. But she used to tell me about, if you have trouble sleeping, the first thing she said I try to relax my jaw. That's the first thing she would say. Yes, this was years and years ago, and I never forgot that. I'm talking back this is back in the late 70s and early 80s. She said, when I know I was having trouble, it's just, Mike, if you're having trouble falling asleep, just try to think about that. Relax your jaw. And she was so right and so ahead of her time.
That's a biofeedback thing, and that is part of treatment for this.
304-345-5858. 304-345-5858 if you'd like to ask Dr. Jeannie K. Bailey some questions about this, because it is important. And you know why? Because you've done it. I know everyone that's listening to this broadcast today, you did grind your teeth at one time. You have clenched your teeth, and I'm sure more than once. But now we have to decide, how much are you doing it, what kind of damage, and what's causing it? And I think that's a big thing we're going to delve into today. Well, let's talk about, you talked about some of the causes, maybe just to tease it, maybe after the break, about diet. I was really surprised when you said diet can affect this.
Yes, diet is a big one, so we'll go over that.
But we'll take a break. When we come back, we'll talk about that. I'm here with Dr. Jeannie K. Bailey, and it's always about something interesting. Here's the deal. I love doing these shows because I know who's ever listening to the broadcast, you are affected by this. If you'd like to call in, you're certainly welcome. This is 58 WCHS, the voice of Charleston.
WCHS!
Would you go from here to there or go to almost anywhere? West Virginia knows what it means to ride in comfort and be green. No gas to pump, no travel stress. Enjoy the ride that's cost you less. You're good to go. Just ride with us. It's round the corner. Now, hop a bus. This message brought to you by the West Virginia Public Transit Association and your local transit system.
Joe is a bargain-conscious consumer.
Yes, I am.
He prides himself on always getting the best deals, researches his purchases,
It's very important.
and makes sure he never falls prey to one of those misleading offers.
Exactly.
Then Joe heard about getting all of his carpet installed for one low price. He skipped doing his normal diligent homework because, well, the offer was just too good to pass up. Then he got the bill.
What? How did this happen?
Joe has fallen prey to the box store add-on letdown. See, Joe, when you read the fine print, they charge for tax strips.
What?
Separate removal and disposal fees.
Unbelievable.
And of course, stretching.
Stretching?
And because you didn't meet the minimum purchase requirement, you also paid for installation.
My wife's gonna kill me.
Any final words, Joe?
Oh, I should have gone to ESC.
Just outside left field of Power Park, Smith Street, downtown Charleston.
Hunting season's over. It's too cold to fish. Well, we have what the doctor ordered. It's time once again for the West Virginia Hunting and Fishing Show at the Charleston Civic Center, presented by the West Virginia Trophy Hunters Association. A weekend filled with turkeys, coyotes, and good times with good friends. 58 WCHS will be broadcasting live all weekend from the event. If you've decided you're going to take a big hunting trip out west next year, a fishing trip to Canada, or are looking for that adventure of a lifetime, this is the place to do it. Hunting and fishing guides from around the world will be gathered under one roof. Narrow your choices, talk out details with each, compare prices, make a decision, and bring your checkbook for a deposit. Nowhere else can you do that in West Virginia this weekend. Plus, check out loads of taxidermy, hunting and fishing equipment, a number of sportsmen's organizations, and as always, I'll be broadcasting a special 3-hour edition of my show, Ram Trucks West Virginia Outdoors, live from the show floor. Today through Sunday, the West Virginia Hunting and Fishing Show at the Charleston Civic Center.
I'm just trying to make it happen, every day. Me and my girl, we've got a baby, and I love that baby. But sometimes the baby cries, and for a really long time. And it's not easy, but, babies cry. Someone told me, keep cool, make sure the baby's okay, safe and sound in the crib, then step away for a few minutes if you have to. That's some of the best advice I ever got.
Never, ever shake a baby. Sponsored by the Team for West Virginia Children and aired in cooperation with the West Virginia Broadcasters Association and this station.
Wouldn't it be nice to keep an income rolling in even long after you retire? At RBC Wealth Management, we work with you to create a plan to manage your retirement funds, giving you a steady flow of income throughout your retirement. Call your financial consultant today to learn more about turning wealth into income. RBC Wealth Management. We make investing work for you. A division of RBC Capital Markets Corporation, member NYSE, FINRA SIPC.
Join me, Ed Steik, on Tuesdays from 9 to 10 on 58 WCHS.
Good Friday morning. It is Ask the Expert. Dr. Jeannie K. Bailey here on 58 WCHS. And, of course, the phone number is 304-345-5858. Talking the subject matter today, it affects everyone listening. Don't act like it doesn't, affect you. Grinding your teeth, or maybe just clenching, but especially grinding. And then maybe talk about this. What are those signs of bruxism? And that's what it is, or grinding. What are those signs that we should look for?
Well, dentists are always looking at teeth, of course, and we look for wear. So you can look for wear yourself. If your little eye teeth and your front teeth are wearing down, then that's abnormal. The other one is bed partners or parents. Children grind their teeth. So it's always really important. And for instance, I had a child last month that I saw just for a routine examination, and I started wondering, why would this child grind so bad? So when we sent him to the sleep lab, he had severe sleep apnea as a child, and he's 5 years old.
5 years old with sleep apnea.
Right.
Severe.
So parents, when you hear your children grinding, you need to think, wow, this is very abnormal. Another thing is, that acid reflux, that's one of the signs. If you have acid reflux and it's kind of melting your teeth away and wearing down, need to look at that sleep apnea. And another one is, I look at profiles of people. I'll give you a really good example is Robert Redford. If you look at his big square jaw, he has a weightlifter lower jaw. My husband has that.
Now, wait, what do you mean by a weightlifter lower jaw? Tell me.
Well, the jaw's closed by a muscle called the master muscle. That's the weight lifter of the jaw.
Okay.
So when you go to the gym and work out and your muscles get pumped up, they get bigger. Well, people who clench or grind their teeth, that muscle gets really big, and the lower jaw looks very square. They get a square profile. And you can actually watch people, and it'll jump up and down, and you can see it. My husband does that when he thinks. I think there's something connected between the master and the thinking. Right, honey?
He's listening right now. You're talking about him. 304-345-5858. 304-345-5858 if you'd like to ask some questions about this, because this can be, there's some really short and long-term effects of this, and we're having a little fun talking about it, but it's not really funny because, again, it can lead to many things. So, you brought up something. You triggered a memory, as you always do when I get on this program with you. But my stepdaughter used to grind her teeth terribly, and way back when. Now she's an adult with children and all that, but I never realized that she might have been suffering some real sleep apnea. We didn't know, but when she would be falling asleep, you would hear she would really grind her teeth. So now that I look back, those are some of the signs we didn't know.
Yeah, and the symptoms of this, like in your daughter's case, you said your daughter, correct?
Stepdaughter, yes. Stepdaughter. Yeah.
Well, when you grind your teeth long, you're not getting a quality sleep. So when you're waking up with that headache and tired muscles, the lady told you, the 80-year-old said, relax, relax, relax. That's one of the symptoms when you wake up with that headache. Or you could wake up with an earache. That's another one. It even affects your vision.
Really?
Yes.
No. So, you're saying the earache. I had... Every time you come on, I always self-diagnose now because some of these things have happened to me in the past. And so now, these are an indication sometimes of what you're saying is serious health problems. Where does this lead sometimes?
Well, you have to have a trained professional look and see, is it life-threatening, as in the obstructive sleep apnea, or is it something else going on? You know, there's the stress part, and there's the depression goes with it. And, you know, the diet, when we talked about that, I always coach patients on their diet when I see this. And one of the things that I've asked over the years, and I bet you, I mean, I've surprised 1,000 people plus, I'll say, do you eat a bowl of ice cream before you go to bed? And they're like, yeah, how did you know? But
yeah, how did you know? I want to know.
Well, when people have a big sugar load before they go to bed,
okay,
you know, they have to work off that energy. And so if you have a big sugar rush at 9 o'clock at night, right before you go to bed, well, the body has all that to deal with, and it has to get rid of it somehow. So people grind their teeth all night long. They're working out, getting rid of that extra sugar.
You know, it makes perfect sense of what you're saying right now. I mean, even though I hadn't thought about it in that way, you know, you're not, you know, and really you shouldn't eat real late anyway, period. I mean, for all our health reasons. But I'd never thought of it in that way. You eat that nice little bowl of ice cream. And when I say nice little, it might be a lot more moderate than little. Some people like, you know, pretty good chunk of ice cream. And then there it is, that big sugar rush, the insulin and all the rest. And now your body's got to do something to work off that energy. And boy, that's not a good time.
And some people think, well, I sleep better. You know, if I eat before I go to bed, I will sleep better. And you've seen people who, if they're gluten intolerant, they eat bread, they get real sleepy, or diabetics in particular. If they eat something real sugar-bound, what's the first thing they do? They get sleepy right after they eat. So people have a tendency to think, well, it makes me sleepy, I'll sleep better. Well, actually, you don't sleep better. You may go to sleep faster, but your body has to work off all those extra calories while you're asleep.
You know, is that then the same, following that logic and following that thinking, then for many people that try to say, well, to get myself sleepy, I drink some wine at night, or I drink a couple beers, or I have a cocktail because it helps me fall asleep. Same thing then applies, doesn't it?
Oh, it's counterproductive. You know, any alcohol before you go to bed at night, especially wine. I was very surprised. Have you ever looked at how much sugar is in a glass of wine?
I'm not a wine drinker, so I hadn't, but I'm sure.
Sometimes 4 tablespoons of sugar per glass of wine.
Hoo-ha.
Hoo-ha.
Yeah.
And then alcohol before bedtime, you know, it always makes you sleepy and you relax. Great, you're relaxed. Well, so are all the muscles in the back of your throat. You get sleep apnea with that. So all sleep apnea patients, no alcohol before bed.
304-345-5858. 304-345-5858. Yes, we are talking about grinding, bruxism, but also those related things that happen to your body and what not to do before you go to bed, because it may be a symptom of maybe a bigger issue like sleep apnea, but the grinding and the clenching and those long-term effects. I'm here with Dr. Jeannie K. Bailey. Dr. Bailey, maybe just me asking a question here. This grinding, what about some of the just more immediate effects? I know that it might be symptomatic of much bigger problems, but what about for your teeth itself? I mean, it's got to affect the enamel and the health of your teeth and all those other things. And you also said about trying to get them in the right position, that clenching. What's some of the short and long-term effects of just even on your teeth only?
Well, the teeth wear down. They go flat. You know, as you grind back and forth, move left to right, it flattens the occlusion. And when you flatten the occlusion, you wear away the enamel, so you're going to fracture teeth. And not only that, you're going to increase tooth decay. In some cases, because you wore the enamel off, and you get down to that nice soft layer underneath, which is the dentin, and it's more prone to get cavities. So your teeth get flat, you get cavities. But the bigger one, because everybody out there knows that I treat TMJ dysfunction.
Sure.
You know, when you grind so hard and these muscles are weightlifting all night long, and you get TMJ dysfunction, and that leads to arthritis too in the jaw joint.
Well, I know there's so many related things, and certainly always getting back to the sleep apnea, which again, everything we're talking about doesn't seem to have that nefarious it doesn't seem so nefarious until you get to the sleep apnea. That can be a life-threatening situation. These things are serious. 304-345-5858. Here with Dr. Jeannie K. Bailey. And, just a simple thing like not eating ice cream. I know a lot. When you said that, my memory trigger, I know 3 people, really personally, that really like that bowl of ice cream before they go to bed. I mean, I know when you said that, I'll tell you what, my brother-in-law, great guy, but this guy's an ice cream eating machine, but he likes his bowl of ice cream before bed. And boy, oh boy, kind of understand some things. By the way, he's been going through some health crisis lately too. And I can't wait to call. I'm going to call him after the show and tell him to stop eating the ice cream. But he really has. He's been going through some real health situations that they've had a hard time pinning down. And I just bet, I wish he was in this city. He lives in Michigan, because I would scoot him right over to your office for a full examination and the series of questions that you do to kind of find out, hey, what's going on in this body?
Well, one of my best friends, he practices in Michigan, and he does a radio talk show host. So we're always comparing notes on,
oh, is that right?
Well, what are
Okay.
you talking about this week? And, I love touching base with Dr. Klein because we both do radio talk shows.
Well, good. Well, I'll have to tell my brother-in-law them to tune in, because really I do think some of this may be effective. They've had an awful hard time understanding a lot of symptomatic things, and it's he's been to the Cleveland Clinic. He is really, and I don't think still they have a real good handle on this. And I'm just wondering, it just seems to me, the more shows I do with you, the more I think it's going back to more sleep apnea related and those causations that you always talk about. He's starting to fit into many of those categories, and I don't know if he's ever really had a good intake examination from someone like you that is an expert in this field. And that may be a situation that he hasn't just looked into, because he's been to more traditional doctors. Is it blood pressure? Is it diabetes? Is it this and that? But it may be sleep apnea the more and more I hear about this. 304-345-5858. I'm not diagnosing. I'm just guessing now. So we need to get him into maybe Dr. Klein in Michigan. Let's go on and say these serious health problems. How much more does this go on as this this bruxism and clenching and all these things are happening?
Well, it can cause recession of the gums, as the tooth wears. And sometimes I see these patients, it's really amazing. The body does defense mechanism. I'm always talking about that because I think it's, the body wants to live. Well, the body wants to keep its teeth. So some of my patients who come in, the bone around the teeth gets so fat because it thickens up, it gets very dense. And you can ask anyone in my profession who has to extract teeth, if you take someone who has bruxed for years
right.
and try and get a tooth out, it's like setting concrete. And if you kind of have to watch on patients like that because the teeth are cracked.
Oh,
so
boy.
you get that sequela of where it's set in concrete and they're cracked. So it makes it very difficult.
What you're saying, it makes so much sense to me now, because when you're aging, we're always told to do some resistance-related exercise. Why? To keep our bone density, so that our bones don't get thin and weak. We're told to do that. But if you're grinding and clenching and bruxism, I never thought about it. You're really building up that bone mass in your mouth, so to speak.
And we call it steel reinforcement.
Still
in my office, anyway.
304-345-5858. I'm learning lots of stuff here. I'm going to have to wait till I call my brother-in-law up. He's going to think I'm smarter than I am, but I'll certainly give you credit, Dr. Bailey.
Oh, thank you. And you did mention that, I'm an expert in this field. I just want everybody to know, I am not allowed to say I'm an expert. I'm a general dentist, but I just have special interest in TMJ dysfunction and sleep. And, I've limited my practice to that. So I just have that special interest in that area.
And talk about, we always go back to with sleep apnea. So many people are using these big masks and all these other things, but it doesn't work for everybody. And you have really, I think, pioneered in many ways this porcelain device. that changes people's lives, literally.
Yes, it's acrylic now instead of porcelain, just so we know. But, that's one thing that you can do, not only for the sleep apnea. I make an oral appliance, keep the teeth apart, and that preserves the tooth from wearing when these people grind all night, at the same time helping assist open the airway. Or when people grind and they don't have sleep apnea, we make a little guard as dentists it's a night guard, and people wear it when they sleep at night to get that bite in the right position and to keep from wearing the tooth down.
Well, as one thing about it, our body is very regenerative. It's a marvelous, unbelievable tool, how our cells regenerate and all these things. But when enamel goes, from what I understand, enamel goes.
It doesn't come back.
There's no regeneration of enamel. Is there anything you can do after years of this? What's some of the things they can do to maybe, like you said, maybe that guard at night and making sure they're sleeping well? I mean, is that? I mean, you really can't put the enamel back on. All you can do maybe is preserve where the patient is at that time.
Well, yes and no, and I'll give you an example. First, you have to find out what's driving the boat. Is it a neurological? Is it the teeth being in the improper position? So after a proper diagnosis, some people have come to me and said, I want my teeth back. So I do full mouth reconstruction and build the teeth back. I did that on my husband. He had ground so much, so long, and he had lost vertical dimension, which means, the bottom of his lower jaw was shorter. So we made his teeth taller. In some cases, when you build it back up to the right place or the neuromuscular place, then people quit grinding.
I'm here with Dr. Jeannie K. Bailey on 58 WCHS, and we are talking about, a subject matter I know everyone listening has been affected by, and you've done it. Don't act like you haven't. Grinding your teeth or clenching your teeth. But it can be a deeper sign. It can be a sign of something much deeper and something much more dangerous. And it affects your whole body and your whole health profile. We'll be back with Dr. Jeannie K. Bailey to talk about that and much, much more on 58 WCHS, the voice of Charleston.
WCHS!
WVStaycations.com has always featured detailed information for all things West Virginia. Bed and breakfasts, camping, wineries, fairs and festivals, hunting, shopping, skiing, you name it. Now, we're your one-stop shop for huge savings. WVStaycations.com is teaming up with the top travel destinations in West Virginia to let you experience their piece of almost heaven for less. Your perfect winter getaway is waiting at Cafe Semino Country Inn. Enjoy a candlelit gourmet dinner by a glowing fireplace. Sink into a luxurious soaker tub for a bubble bath before bed. Awaken to your 3-course gourmet breakfast. Then take a walk or make a snowman in the winter wonderland of the grounds. Or just curl up by the fire for that second cup of coffee. Make your perfect winter getaway at Cafe Semino Country Inn. Now, get a $100 gift certificate to use toward accommodations and dinner for two Tuesday through Friday nights for only $50. Log on to WVStaycations.com and save. That's WVStaycations.com.
Hello? Hello? Hi.
What?
I'm Lisa from CharlestonHelpWanted.com.
Who?
CharlestonHelpWanted.com.
Never heard of it.
Look, I know some people think of us as entertainment, but lots of people find jobs through us. So in order to be taken seriously, I'm going door to door with my harp.
I'm not home.
Then who's talking?
Are you gonna play the harp?
Are you a harp fan?
Nope. Beautiful.
Thank you. Employers find local qualified employees.
Oh.
Post ads in minutes.
Oh.
Start getting resumes right away.
Don't sing.
CharlestonHelpWanted.com.
Long name, amazing results.
I thought you never heard of us.
Nope, never.
Some people think we're just tile.
And some people think we're just granite.
But we're both.
And so much more.
Casto Tile and Marble. From subdued ceramics, dramatic stone, brilliant glass tile, retro hip-hop in all sorts of colors, granite, marble, soapstone, even wood flooring options, Bob Casto is a master of the craft and is there to speak to you about your needs.
Casto Tile and Marble.
728 First Avenue South of Nitro. Call 304-755-7695 for Casto Tile and Marble. A cut.
And polish.
Above the rest.
Presenting all 50 reasons to switch your business to the new Sage 50 accounting software. Ready?
Ready.
Go.
1. Sage 50 is quick to install and easy to use. 2. Turns information into insights. 3. Improves efficiency. 4. Easily tracks and forecasts cash flow. 5. Supports online banking. 6. Creates and manages budgets.
Time's up.
What?
6. Seriously? For all 50 reasons and a free trial of Sage 50 accounting, visit sagetoday.com/50.
Wait, I can do it.
Oh, that's sweet. sagetoday.com/50.
It's a guy thing. Metro News Hotline with Dave Weekly.
On the next edition of Hotline, our new Whip Around segment gives you the stories that the people who cover the news are talking about. NFL All-Pro Carl Lee will be in studio to break down Sunday's conference title games, and we'll look back at last night's new episode of MTV's Buck Wild.
Metro News Hotline with Dave Weekly. Weekday afternoons from 3 till 6 on the Voice of Charleston, 58 WCHS.
Hey, good Friday morning. It is Ask the Expert. Dr. Jeannie K. Bailey is here. Answer any question. 304-345-5858. And what are we talking about? Something that affects everyone listening. Bruxism. I sound like I know what I'm talking about. I'm just a parrot. I'm just repeating what Dr. Bailey is talking about, and that's grinding and clenching. You know, we're talking about understanding these things, and how do you know? How would you know that maybe you're in this category? In other words, it's becoming a health risk. It's causing other things rather than a dentist telling you this. How can you kind of know yourself to get yourself into a place then to say, hey, I think I have this issue?
Well, if you wake up with that morning headache or your jaws feel tired, you know, that's a warning flag. And you can look in the mirror and see if your teeth are wearing down. And then the dentist can look at it, or the physician, and a EMG can be ran. An EMG is where they put a little electrodes. There are portable ones, or you can go for a sleep study in a formal sleep lab by a board-certified physician, and they actually put monitors on you to see how bad you grind your teeth. Now, we do that as well. I can always look at the teeth, and I can see if there's wear, but we have home sleep monitors as well, and it has a little electrode you put on the jaw to see how much pressure is put during the night while you sleep.
So a very simple little device, a little wire, and it just attaches to the jaw, and a couple nights, and you kind of know what's going on.
Yes, and there's disposable ones, and then there's the ones like mine that I can look at other things as well. You can monitor, you know, your oxygen at night and monitor the loudness of a snore, but it also, you know, it's checking the muscle activity while you're asleep.
Well, I've been around people that their snore so loud, you could monitor the volume of their snoring in the next room. I mean, it's bad sometimes. It really is.
Well, after deer season, I've had several guys come in, and they said, I snore so loud that my hunting buddy said, why don't you do something? And several of them listened to my talk show. They said, why don't you call Dr. Bailey? And I actually had 2 hunters come in and said, can you help me? Because I am disturbing my hunting buddies.
I actually went to a seminar. It was a bunch of guys in a lodge, you know, and we were in this seminar. And long story short, you know, you don't usually sleep in a big room with a bunch of guys, you know, and there was a guy there that snored so loud, he was waking everybody up. And then one of the guys yelled out, that's about a 7.8 on the Richter scale. And then everybody busted out laughing. And he woke up going, hey, what's going on? What are you guys laughing at? They didn't know it was him. I mean, but again, so loud, it was true. But anyway, but there's simple ways. You know what we haven't given out? Your phone number at your practice. Let's do that too.
Okay, it's 304-757-7428, and you can always visit my website at www.westvirginiasmileartist.com.
Love that, smileartist.com. Well, you know, we're talking, again, this subject matter I think is close to home for everyone, but I think they've not taken it as seriously. Maybe it's just nerves or just the way it is, or maybe I drink too much coffee. And, you know, we like to find quick, easy answers to sometimes very complex issues because we don't want to face what's going on in our body. And that's kind of a, you know, human nature. But I think something I think you've pioneered a lot of bringing to the forefront not just the short term, but the long term and the causation of some of these things, it can be pretty serious stuff. Again, we go right back to sleep apnea, which can be life-threatening.
Yes, and there's lots of really good things you can do that are very simple, like cutting out the ice cream before you go to bed. There's a lot of home remedies that you can do. If you wake up and those muscles are sore, you can put ice on it, and kind of make that muscle spasm go down. If you're having the headache or you feel like those muscles are tired, and drink lots of water during the day. That's a very simple thing to do.
Okay, why is that, to drink lots of water for this particular condition?
Okay, you're hydrating the body. When people drink caffeine,
like I'm doing now with my coffee.
And me too. But every time you drink caffeine dehydrates the body, which dehydrates the muscle, and it feeds that muscle spasm. It activates muscles, and it keeps you from sleeping, of course. So water not only flushes things out, but they also say every cup of coffee you have, you should follow it with a glass of water.
Now, that was going to be my next question. That is not an old wives' tale, then. If you drink, again, I'm drinking this big cup of coffee, I should drink a big cup of water to match that.
Hydrate yourself, because it's a dehydrator.
304-345-5858, 304-345-5858. I'm here with Dr. Jeannie K. Bailey, and her phone number is 757-7428, 757-7428, if you want to call her at the office. And for all you hunters out there that have you've been the cause of some of your buddies not getting sleep, you should go check out Dr. Bailey. There may be a much more serious condition that your body is facing. And Dr. Bailey, I think the thing I learned here, we don't have to put up with very diminished health. There are causes why our health profile starts going down and our immune system is getting affected. We can get older, but we don't have to accept, I'm not healthy because I'm old. We really don't have to accept that.
Correct. We have a right to be healthy. And I always say the body wants to live, and we do all these self-protective mechanisms. So it's important to realize when you see those red flags flying, your body's asking you for help. It wants to live.
I think that's going to kind of get inculcated in me. You use that a lot, and it's true. I mean, your body wants to live, and the way it fights for oxygen at night, or even with teeth grind, all this has a reason. Your body is trying to do something to live. It's responding to. We're just, I guess we have to become a little better listeners and watchers of our own body. It's something that I don't think many of us have done very well with in the past, that's for sure.
Yes, and like the myriad of sleep apneas, the first thing your body in wanting to live is going to do is going to grind, because it's trying to open that airway. The second thing it's going to do, it's going to give you a Heimlich maneuver all night long. It's CPRing. That muscle underneath your lung.
Okay.
When someone's choking, you have to do the Heimlich maneuver.
Right.
It'll do that all night long, and that's where the acid reflux comes. And then the final thing is the body does that all night long. It says, well, let's make them get up and go to the bathroom. Got to pee? People who get up 3, 4, 5 times a night, red flag. It may be sleep apnea, and your body wants to live. So those are my 3 I always go over with every patient. Do you do this?
Wow. You keep talking about me, Dr. Bailey. 304-345-5858. I mean, it really is worth it to come and see. I know many of the things you're talking about, I know are affecting people. But I know they're writing it off in their mind. They're self-justifying. They're probably saying, I know it might be that, but it's probably not. But coming in and getting an evaluation and talk about the kind of evaluation you do, because it is really extensive and it takes in so much more than just a few questions.
Correct. And when I did this program with you today, I thought, I wonder if we'll have any callers, because it's a hard topic, to call in on. So I thought, well, I wonder if anybody out there is listening. What number would they call if they have a question?
Yeah, 304-345-5858. Of course, it's one of those things you don't want to admit to.
Correct.
It's like, or it's, mine's really not that bad. Yeah, I know occasionally I do, but so does everyone else. It's those kind of, dismissive attitudes about, I know I do it sometimes, but I'm sure I'm not in that category. And that's where an evaluation with you comes in.
Correct. It's always fun for me to see patients because they think they're coming just for dental, but I always talk about the whole body. I never look at one factor. There's a lot of straws on the camel's back. I always say I can lift off a few sometimes, so I like to look at the whole picture.
Again, if you'd like to get an appointment with Dr. Bailey and make sure you're not being dismissive, you're not minimizing what's happening to your body, it's her number at the office is 757-7428, 757-7428. And, of course, or you can talk to her now, 304-345-5858. Dr. Bailey, so many of the things that you have brought to light and made important are things that we have minimized and been dismissive of. And let's go to the phones. I know now all the lines are lit up, by the way. So, okay, they're admitting. They're saying, okay, I'll call. Hey, Bill from Lincoln County. Good morning, sir.
Yeah, good morning. Hi, doctor.
Hey, Bill.
One question is your treatments for, say, snoring or TMJ or grinding, is that under medical insurance or dental insurance?
Bill, it's all under medical insurance because these are medical problems. I do not even bill dental insurances. And, there's actually a medical code for sleep bruxism.
Did not know that. I don't know the code, but I'll just ask when I need it.
We'll give you the secret handshake, though. Don't worry about the code.
All right. Well, that was my question.
Thank you, Bill.
All right, Bill. Thank you, sir. Well, he didn't know the code, but, again, we'll give him the secret handshake. We'll go to the phones. We'll keep going here. We want to get everyone in. David from Charleston. Sir, how can we help you today?
My wife, when I go to bed, she snores real loud, and I can't go to sleep. She keeps snoring over and over, and I have to tap her to give her time to be quiet because I can't sleep.
I hear that so often, David. Some people, they try and go to bed before their bed partner so they can go to sleep first, so that's one of the things. But has your wife been checked before for sleep apnea?
No, she has not, because it's bothering me, because I have to get up 3 or 4 times a night to use the bathroom, which I don't mind doing.
Well, that's also an indication of sleep apnea. So your wife should be evaluated, and you need evaluated also to make sure that you don't have a life-threatening condition, which is sleep apnea.
Well, what do you suggest we do?
Your physician can order a sleep study, or people come to me. I do an evaluation because then I can look and see, do you have other red flags flying? And I can line up a sleep study for you and your wife at a board-certified sleep center.
Okay. So when do you want me to make the appointment?
Well, just call the office, and that's 757-7428, and we'll sit down and have a consultation and go over everything together.
Repeat that again. Right there.
Okay. It's 757-7428, David.
7. Okay, go ahead.
7428.
74.
You know what? You need to turn your radio down. That's really the problem. I'll tell all the callers, when you call in, turn your radio down because you're getting our delay, and it makes it very difficult to communicate.
Okay, I got it.
Thanks for calling in, David. Good questions.
Hey, you're welcome, and I'll call the office today and see if I can set up an appointment.
All righty, good stuff.
Good.
Thank you, David. We want to get to another call. We usually take a break right now, but I'm going to hold off on that break so we can get to this last call. But Scott, how can we help you, sir?
How are you all doing?
Very good, Scott.
My question is this. I have sleep apnea, but I've noticed this also, that if I'm in a hospital and they can't give me a CPAP machine, I don't have that problem being able to sleep and stay in a normal sleep without waking up with a headache or anything. Could it be my bed or something like that?
It absolutely could be your bed. But, you can elevate your bed at a 15-degree angle. But if you've been diagnosed with sleep apnea, if you're in the hospital, it may be the bed, but you still have sleep apnea, my man. So you need to realize that maybe it's the bed, slight involvement, but you still will have sleep apnea.
Was there any kind of bed they can recommend or something like that? Should I check with the hospital and maybe get a bed like that?
Well, try first elevating your bed and see if that makes a difference, because that helps with people who have acid reflux. If you just prop it up slightly, the headboard, 15 degrees.
I'll tell you what, Scott, I'm going to put you on hold because we've got to move on. We can answer this question. We have to take this break. We'll be back with Dr. Jeannie K. Bailey on 58 WCHS.
WCHS.
This is a court-ordered legal notice. There is a settlement in a class action lawsuit over the use of a certain type of water treatment chemical called polyacrylamide, often called flocculant or flock. Many coal preparation plants in West Virginia and Pennsylvania used the chemical. Water treatment plants in West Virginia also may have used it. The settlement is with several chemical companies who made or sold the chemical. The settlement provides approximately $6.6 million for medical examinations for those who are included. If you worked at a coal preparation plant in West Virginia or Pennsylvania, or a water treatment plant in West Virginia, you may be entitled to a free medical examination. To learn more about the settlement and your rights, go to flocsettlement.com or call 1-877-738-3562. That's flocsettlement.com or 1-877-738-3562.
Hey, it is Good Friday morning. Not Good Friday, but just it's nice Friday. And with Dr. Jeannie K. Bailey, we're going to go back to the phone. We want to finish our conversation, but we just have about a minute left. Scott, any final questions you'd like to ask the doctor?
Well, no, but that is a good recommendation because I always figured it had something to do. I mean, I know I have sleep apnea, but the fact that when I'm in the hospital and I don't have a machine, that I've noticed that helps. And any kind of solution does help as a backup because, like, you know, these nights when we're all without power, I'm really in a bad way then.
Correct. And, you know, another thing, Scott, they say replace your bed every 7 years, your mattress, and not everybody does that.
Oh, really? I never heard that before. Thank you.
Mm-hmm.
All right, Scott, I hope this all helped, and you have a great weekend.
You too.
All right, Scott. Well, we covered many areas. Thanks for coming in today, Dr. Bailey, and I'll give out that phone number one more time. Someone that called, you need to make your appointment. Don't self-diagnose. This can be a lot more dangerous than you think. 757-7428, 757-7428. Dr. Bailey, thank you so much.
Oh, thank you. I had such a good time.
I learn all the time. I'm glad you're not doing a pop quiz, though. Hey, this is Mike Agnello. Coming up, you know who's coming up, Hoppy Kercheval, then Rush Limbaugh, then our new show, Hotline with the Voice of Charleston.